No, you have to say action.
I did.
Oh, okay. So we're rolling?
We are.
Awesome. Welcome back. This is the next. I'm not going to say numbers anymore because I kind of lost track of how many numbers, videos that we've done with this intubation series for you. But you can see I've got Graham today instead of Diane. Diane's actually in class with you as we are filming this right now. So Graham is providing ventilation for this patient that we intubated yesterday. So to recap what we've done, we basically made some tapes. We intubated the patient. We've secured the airway once we've intubated the patient. We've called for chest x-ray. Chest x-ray has confirmed the exact location of the endotracheal tube, so we don't have to move it. And now what we're going to do is do our last step with the intubation, and that is assessing cuff pressure. So Graham's providing ventilation for this patient. If you look at the setup right over here, you can see he's holding on to the endotracheal tube. To the endotracheal tube, we've got the closed suction system set up if we need to suction our patient out. We have the end-tidal CO2 detector, but you know what? We can take that out. We already know that the patient happens to be in the correct spot, so we're going to take that end-tidal CO2 device out. It's no longer required because it's simply just a color change. It confirms placement. We've got our tapered flex tube, PEEP diverter on our bagger, and we have our PEEP valve on as well. And little blooper here. We need a little bit of oxygen in here running to our patient. It is first thing in the morning. We are a little bit, I guess, drowsy, you could probably say, and some of us are still possibly a little hungover. Hey, son, tied one on last night?
I'm fine, thank you.
Awesome. You can tell you're a little red there, so probably some of that, we won't go there. Anyways, what we're going to be doing now is assessing cuff pressure. So there's a couple ways you could do this. You could use one of these things, called a Hans pump and ball, or also known as a cuff insufflator or cuff pressure checker. Most of the hospitals have something like this. Consists of a gauge that tells you the pressure of the cuff. Also gives you some colored indicators to let you know whether you got the right pressure or not. Has a little device right over here that allows you to attach it to the pilot balloon line. Has a bulb that you can pump up the pressure of the cuff if you need to by adding volume to the cuff. And has a little red button on here, back here, that you can press to let gas volume out of the cuff to get the correct pressure that you need. That's the correct volume. So what we're going to be doing is showing you this one, and we'll also be showing you more of a manual way of using it. All you'd be using or doing for the manual technique is using a syringe. 10 cc syringe should be sufficient. 3-way stopcock, cock-a-doodle-doo. And a pressure gauge, a simple Borden gauge pressure gauge. That's Borden, not Borden. That wasn't really funny. We should strike that. Okay, so the first things that we're going to do is you have to locate the pilot balloon line. Here's the pilot balloon line for the endotracheal tube that we've inserted. What I'm going to do now with this 3-way stopcock is I'm going to attach the lower lock part of the stopcock to my syringe in this fashion right over here. So I've got it attached. I'm also going to pull back a bit, give myself maybe about 5 cc's or so in the syringe. And I'm going to attach the pilot balloon line to, sorry, not the pilot balloon line, I'm going to attach the pressure gauge to another port on my 3-way stopcock. Now I've got the off tab pointed towards this open port. This open port here is going to get attached to the patient's endotracheal tube's pilot balloon line. So what I'm going to do at this moment is I'm going to pressure up to 20 centimeters of water pressure, the pressure gauge, with the gas volume I have in the cuff, in the syringe. So there we are, it's sitting right around 20 cc's of pressure. I've just simply added gas volume and pressure to the gauge here so that when I attach the device to the pilot balloon line, I don't lose all my gas volume in the cuff. Because remember, gas goes from high pressure to low pressure and always takes the path of least resistance. So the two techniques we're going to demonstrate are minimal leak technique and minimal occluding volume. We always do minimal leak technique first to take down the amount of volume in the cuff till we hear a leak, and then we add a small amount of gas volume back into the cuff to get rid of the leak. And that would be minimal occluding volume, or MOV. So what we do is, since our patient's been intubated and being ventilated, we always listen for the leak during inspiration. And the reason for that is that's when the trachea is the widest because of the pressure that we're putting inside the patient's chest. So when you're doing this technique, you should take your stethoscope, place your stethoscope in the soft portion here, not right on the thyroid cartilage, but just to the side, laterally from the side of the thyroid cartilage. Your stethoscope there, attach everything, and then start doing the procedure. So what I'm going to do now is I'm going to take the open end here, although the closed tab is to this unused port of the three-way stopcock. I'm going to attach it to my pilot balloon line like so. Now I'm going to let all three ports communicate with each other, and I should see an increase in volume inside the pressure gauge. There, it's gone up to about 50. So I'm going to take my stethoscope, I'm going to place it over here like so. I'm going to just move for you so you can see. Place it here like so. And as Graham takes some gas out of the, or ventilates the patient, I'm going to remove a little gas from the system. And I'm listening for a leak on inspiration. Just a small amount of gas at a time. So I don't hear a leak yet. No leak. No leak, a little bit more volume out. No leak. No leak, I'm down to almost 20 centimeters of water pressure. No leak. No leak. Oh, now I hear a leak. I'm at 17 centimeters of water pressure. So my minimal leak I hear at 17 centimeters of water pressure. I'm going to add a little bit more gas to the cuff. And right around 19, 20 centimeters of water pressure, the leak disappears. That's my minimal occluding volume. So we're good. Minimal leak, minimal occluding volume for our patient. What I'm going to do now is simply detach the port that's attached to the pilot balloon line. There. So we've just accomplished with the pressure gauge, the three-way stopcock, and the syringe, minimal leak and minimal occluding volume for this patient that's been intubated. The other device that you could use is this cuff pressure checker. It's just another way of confirming that you've got the right pressure inside your patient. Now if you take a look, you've got the green zone, which signifies an adequate or normal cuff pressure, and you've got your red zone right over here that pertains to the higher pressures, the more dangerous levels inside your patient's cuff. So all we have to do with this device, simply attach it and see what the pressure is. Now I added a little bit more volume to the cuff for effect just to show you how this works. The pressure inside the cuff right now is sitting right around 50 centimeters of water pressure. It's a bit too high. So what I'm going to do is just slowly allow the gas to come out by pressing the red button at the back. And without attaining minimal leak, I've got my pressure sitting right around 22 to 24 centimeters of water pressure. It's in the green zone. All it's telling me is that I've got sufficient pressure inside the cuff. All I'd have to do now is simply take gas out, listen with my stethoscope, add gas back in until the leak disappears, similar to the other system that I used, and that would allow me to attain my minimal leak and minimal occluding volume. Once I'm done with this, remove the cuff pressure checker from the system. My patient's airway is now being maintained. And the cuff has the adequate amount of pressure inside of it to maintain a seal with the least amount of pressure. You want to add anything at all, Graham?
Sometimes when using the cuff pressure checker, it might be ideal to give it a little extra puff because when you disconnect, you actually lose some of that pressure. So
You get the puff by?
Squeezing the bulb.
By squeezing the bulb. I think that's it.